and the other form. And if there is the dysfunction of the endothel, they are these part below, then we have the other problem, and we have in this case hematuria. And apart from that, when we have a hematuria, then in this case hematuria in combination with proteinuria, if the endothel is damaged.
Kann es auch zum sogenannten
and this leads to nephritis syndrome, which causes the reduced in the GFR because the endothel is damaged because of the inflammation. And in this case, there is oliguria, and the patient develops edema and is hypertensive. In this case, the worst case is RPG, and it is the rapid and progressive glomerulonephritis, which is kind of the STEMI in cardiology. It is the same in the nephrology. It should be treated very fast. And for the diagnosis, we have to look for the urine diagnosis with urine sticks and through the microscope. As an example of urine diagnosis, you can see here the red one. This is the protein. Protein is high, it's 500, and there's also erythrocytes. And the urine diagnostic, we can see about 4,000 milligram of the protein, and apart from that, the albumin is more than 3.5. And when we go to the microscope, what we can see are the erythrocytes. They just look like Mickey Mouse, and they are disformed because of the inflamed endothel, which is also typical in case of glomerulonephritis. And for further diagnosis, this recommendation is a biopsy of the kidney, and it is performed with the help of the ultrasound. It's FNAC, and the probe would be sent to the microscopy and to the immunohistochemistry. And for the division of the glomerulonephritis in primary and secondary, they are manifested just in the kidney, and it's minimal chains, FSGS, membranonephropathy, EGA nephropathy. And in case of secondary, they are not only in the kidney but also in the other organs and most in the blood vessels. They are ANCA-associated vasculitis, anti-GKM good pasture, lupus, and EGA vasculitis, and when it's membranoproliferative glomerulonephritis. And you can also divide them based on if they are nephrotis or nephritis. Like green, it is minimal chains, FSGS, and membranonephropathy, they are nephrotic. And nephritis, where there is hematuria and proteinuria, like EGA nephropathy, EGA vasculitis, lupus, anti-GKM, and ANCA-associated, all are orange. They have nephritis symptomatic. And above all, the four forms, ANCA, anti-GKM, lupus, and EGA vasculitis, they can go to the rapid progressive glomerulonephritis, which is acute and a very progressive, aggressive dysfunction of the glomeruli, and in about days and weeks, and it can cause to a acute kidney dysfunction. Histologically, when we see the rapid progressive glomerulonephritis, we can see lots of cells. They are infiltrated in the glomeruli. This is the normal glomeruli, but this, you can see there are lots of stains, which is the proliferation of the cells, and the glomerulum is damaged here. And these are called as crescents.